We're delighted to be a co-sponsor for this event. I'd like to acknowledge the Federal Reserve Bank of Minneapolis, the Humphrey School of Public Affairs at the University of Minnesota, the Upjohn Institute, and the wonderful, gracious host, the Federal Reserve Bank of Chicago. I don't think I'm going on a limb here, but I think our center might be the least well-known of the other co-sponsors. So let me just talk briefly about the Neal Center. Our mission is to inform citizens, policymakers, and other researchers on the extent, scope, and effects of occupational regulation. So in addition to sponsoring wonderful events like this one, we also have a database that we maintain. It is at csorsfu.com. Or you could just Google the Neal Center and you'll be taken to our website. We are working with a couple of states right now that are interested in taking a look at occupational licensing reform. So it's apropos, I think, that I was able to chair this session, linking research to policy. That's exactly what we try to do at the Neal Center. This past October, the governor in Pennsylvania, Governor Wolf, issued an executive order to review occupational licensing requirements in the state, and we were fortunate. It was a marriage made in heaven. We were in Pennsylvania. We had a governor who was willing to look at this, so we partnered with the governor, and we prepared a report. It's really light bedtime reading. You can take a look at it, the executive summary for Pennsylvania. And after that report was published, the governor proposed scaling back occupational licensing requirements for 13 occupations in addition to some other fundamental reforms. We'll be working with the state with Department of Labor funding over the next 3 years to continue to pursue occupational licensing reform and take a hard look at it. We're also going to be working with the state of North Dakota on a similar project. If there are other states, we are small. The back corner of the room right there, that's the official Neal Center corner. But if you are interested in pursuing occupational licensing reform, or you're interested in doing research into this topic, we are a resource that will be available to you. So I'm very happy to be on this panel where we have a very distinguished group of panelists here. To my immediate left, Dereck Neal is Professor of Economics in the Kenneth C. Griffin Department of Economics at the University of Chicago. Right next to Dereck is Kevin Murphy, the George J. Stigler Distinguished Service Professor of Economics in the Booth School of Business at the University of Chicago. And last but certainly not least, Ryan Nunn, who is the Policy Director of the Hamilton Project at the Brookings Institution. This panel is going to be a little bit different. You know, we like to make sure everybody stays awake. You know, we're getting later into the afternoon. So we're going to try and keep the introductions a little bit briefer, about 7 minutes, if that's okay, with the panelists. And I'm going to ask a couple questions because I think this topic in particular really deserves dialogue. So I'm hoping that we'll be able to engage. And, you know, as Erica said, our keynote, you know, I think if we leave with more questions, you know, I think we've really done a service to the panel. So without any further ado, let me turn things over to Dereck Neal.
Morris told me to talk about the connections between my research and occupational licensing. So I had to think about, what does my research have to do with occupational licensing? And the answer is not much. But I just had a book come out this spring that Harvard published, now available on Amazon for those who are interested. Information, Incentives, and Education Policy. And it contains some original research and some summaries of stuff in the past that I've done with Gotti Barlevy and Diane Schanzenbach, who couldn't be here today. And the basic theme of the book is that our education policies that govern how we spend public money set aside to buy education services for children are plagued by obvious design flaws. And the other point is that assessment-based accountability, parental choice, school inspections are things that are always thrown up as policy alternatives. But if you kind of write down education policy as a mechanism design problem, you start to see that these are probably all components of one optimal system that would foster regulated competition among schools for students, and the system would involve incentives that would come from whether or not parents were willing to come to your school, whether or not the accountability system gave you bonuses or fines, and whether or not you performed well enough to quote unquote keep your license, your right to receive public funds. And one of the things that is interesting about this is that no one's interested. Okay, I've been working on this about 10 years. In the developed world, no one cares. Even in the places where it's completely obvious that the mechanisms proposed in this book or in some of these papers would dominate the existing things that are used because it kind of fixes transparent design problems. And PFP is the pay for percentile mechanism that Gotti and I worked on. There have been 5 experiments run across the world, most of them in places like China and Uganda and Tanzania, and then one little small experiment that John List ran in Chicago Heights. And when you talk in the US about a true relative performance system that can't be gamed such that everyone is above average, you know, these systems where people are adequate, meet standards, good, very good, excellent, and then after a few years everybody becomes excellent. Those problems are very easy to fix by forcing rankings on the system, that the raters have to give a best and a worst and a middle, and that, you know, and a 99th percentile and a 98th. And you can't get everyone to even talk about that in a serious way in education policy circles. And the master's degree pay bump that is in all the public school salary schedules, they're the barbers of education policy. You can't go to any education conference and find a reputable researcher that will tell you that those master's degree programs improve teaching performance. And they've been around for decades, and no state can get them off the books. North Carolina actually passed a law saying they were going to be off the books in 2014, and I went back right before I sent the book to the press and sent an RA to the library, and he looked it up, and it was still in the code. They still had the master's bump in the salary schedule. So when it came right down to it, they never could enforce it, never could follow through. It must have been a line item veto or something. And so I say all of that to say that occupational licensing, occupational regulation is not the only place where we see a lot of stupidity that appears to be transparent stupidity, and it seems to be permanent transparent stupidity. However, I still will defend all the years that I spent trying to solve problems of the form, suppose I was czar, what would the optimal procurement system look like for education services? You know, what would the planner want us to do? And I think that's one thing that I see missing from the research agenda in this room is a little more careful thought about what you would do if you were czar, and to use that as a baseline to think about what we actually do. And so I don't think there should be any licenses, any certification, or any registration, okay? If it's something that we all say, well, there should be some regulation, like doctors or nurse practitioners or especially surgeons, maybe. I don't want someone that's not a trained surgeon. A different way to go about it is to say that in those professions, you have to have liability insurance. And you have to have liability insurance from a company that puts their name on your wall and says, we insure this guy. And the companies, because they're paying the bills for the mistakes, would have an incentive to hire, young hotshots in big data and find out the best way not only to price the insurance they sell, but to decide who they're not going to insure. Okay? And what you would do is you would take the monitoring and the certification and the decision to say, you have to go somewhere else, or you have to leave this because nobody's going to insure you, to leave that to private actors that have their own money on the table, rather than a set of government regulators who often, may not have proper alignment in terms of serving the interests of consumers. It's very much like what I propose in my book about education policy. You want to create a system where the teachers, the schools are competing, and they have an incentive to make sure their teachers have the right incentives. Here's one quick example here. My wife is a licensed pharmacist in Illinois, and there's a lot that goes into being a licensed pharmacist in Illinois. There's 4 years of postgraduate education. There's a very hard exam. There's another exam on law. There's a year of internship. But, the reason I think I called her to make sure I had this right, whether or not you have liability insurance is just kind of a recommendation they give you in the professional development class. And this to me looks like a crowd out situation that you could imagine it being flipped the other way, that the main requirement to be a pharmacist would be the main requirement that a lot of proprietorships have, that you have to have liability insurance, and it has to cover the types of liabilities that you could encounter if you mess up. Now, why, since I said that we're going down completely the wrong road, why is regulation the default? Well, the number one potential answer is we don't like trial lawyers any better than we like government regulators. So, and then there's also the question of how do you regulate the insurance companies to make sure that they are solvent, when things go wrong, and which, part of this puzzle do we need to worry most about in terms of regulatory capture? But I don't think that you're going to make progress on these types of questions just by doing empirical work. At some point, somebody's got to write down a model that says, these are the things that consumers don't know that they need to know. These are the things that regulators or insurance companies would need to know about the providers that they don't know. These are the things that the providers know that they would like to convey but maybe can't. And for given assumptions about what are the hidden actions and hidden informations that are important, how do the current systems versus relying on insurance and tort, I think there needs to be more first principle thinking about what an optimal system would look like and what the answer to that would hinge on. And then the last thing is master's degree pay bumps and barbers should give us all pause. The barber thing's been around 100 years. The master's degree pay bump has been around 50 years. They have both survived for decades with everybody in the world agreeing that they're silly. But nobody can get rid of them. And so part of me thinks that you need somebody sitting here that's actually worked on formal models of politics and to ask them questions about what are the organizing strategies, what are the strategies involving constitutional reform or how you introduce legislation. What are the ways to go at this intelligently from the political angle to try to be able to just get rid of the low-hanging fruit? Both in education and here, I just see immense stupidity that everyone agrees is stupid and everyone agrees it's rent-seeking, and we still can't get rid of it. And I don't really understand exactly why that's true, but that's another area people need to think more about.
I would add one thing to what Dereck has talked about. It's not just about optimal design in that a lot of the alternatives actually don't have design. They're done through a marketplace where people privately come up with mechanisms to deal with these kinds of problems, whether it's I depend on the grocery store to put in there things that are good to eat, and you know, like I go in there, there's some new product I ain't never seen before, but it's sitting in a grocery store, I'll probably try it. Some guy came up with the same product on the street, why don't you try this? You know, you think I'm crazy? You know, so there's a lot of ways to skin a cat here, and I guess I get to the point where you first got to be convinced that markets aren't going to work well to do it, because, you know, one of the reasons these things stick around is they get institutionalized, and political markets have a lot of stickiness to them, and once you've developed an interest group, it's hard to get rid of them. There are interest groups in markets, but fortunately the consumers often are more willing to take advantage of new things that come along, and ultimately they'll displace. That's one thing. The other thing on the research side I think is important to realize is that it's not all about the two groups that are the most directly affected by these regulations. You might say the most directly affected people would be the consumers of the product. Does this do anything to make the product better for them? I think in many cases it doesn't. There's really very little in it for the consumers. And it's not just about the people who end up getting the jobs and whether it's better for them or worse for them or things like that. And this is one thing I'd push on the research side. How does it change the mix of who gets the jobs? And that has a broader effect than just the people who are there, because one of the things we know has been going on in the labor market in the U.S. for quite a time now is a story of sort of a supply and demand mismatch, where there's more and more demand for skilled workers and declining demand for less skilled workers. And if these requirements are blocking out less skilled workers from getting those jobs and probably then requiring the job to be done by more skilled workers, more highly trained workers. I think about the examples of nurses and things like that. You might say, well, geez, that's going to affect doctors versus nurses, but it's going to affect broader than that because there's a broader labor market. And every time you take a job that's currently being filled by somebody up the skill ladder and say, hey, that job really could be done by somebody else, that may benefit that worker who gets to move into that new job. But it also benefits all the other unskilled workers who now there's less competition for them. And in today's marketplace where we care a lot about, changing labor market opportunities for different groups, this is just one of those many barriers that I think we need to examine. So when you look across state lines, let's not just look to see, does it affect the wages of the guys who get the jobs, but how does it change the mix of who gets those jobs? Is it bringing in more people from the groups that are currently been suffering from oversupply and under demand, and vice versa? I think that's an important aspect, and that's one of the bad aspects I see of a lot of these regulations. They sort of say, well, you have to have this certification or that certification, and it's really the idea that it's the mandate that you have to have it. I mean, if you allow certifications, but the certifications have to compete in the marketplace, and if I say, hey, you're certified to be a great teacher because you have a master's degree, but it ain't really worth anything to have a master's degree, it ain't going to have much of an effect. But if I say you have to have a master's degree, this is old Milton Friedman's old point, government can go into the certification business in competition with all the other mechanisms that exist to ensure supply to consumers. And to the extent they're good at it, that certificate would be valuable. It's when they go into an exclusionary story where they say, oh, we're so good at doing this that unless you have it, you can't compete. I think that's where I think economists say, big hurdle to get over to do that because it really doesn't allow the marketplace to work. So not surprisingly, I come from Chicago. I emphasize two big things. One, think about alternatives, think about what the market would provide, and is this a problem that the market couldn't solve? And number two, when you think about impacts, don't just think about micro level impacts. Think about this is going to have a market-wide impact because it's going to affect outcomes in the labor market more broadly. So again, I think about those two market perspectives. They're really important for both measuring the full impact and asking the question of, do we really need it? Finally, one thing in response to Dereck's point, all the empirical evidence says it's hard to get rid of these things. And anything that tells you when it's hard to get rid of, it should be hard to start. And so we have a lot of new emerging areas where new types of jobs are emerging. There's a lot of calls for regulating them. Maybe there's a story that they need to be regulated, but you better be prepared to say they need to be regulated for the next 50 years because that's the reality of what you're adopting. You're not adopting a temporary regulation while the industry makes its adjustment because it's going to be tougher to get rid of it once it's entrenched than it is to not allow it in the first place. So just keep that in mind.
I just want to add two clarifying comments. I agree with Kevin. The vast majority of these things, there should be no regulation and just let the market solve it. I was saying into things like surgeons or pharmacists, where people can die and that's not an option, then use market mechanisms to regulate through the insurance market. The other thing is I completely agree with your point about quantities, which is why I wanted Peter to put the quantities and the prices in the same paper, because I think you have to do that if you've got a story about how these regulations are affecting things. You should be able to write that model down, solve it on a computer, and it should have restrictions about where we see quantities and prices moving in certain ways together, and that's a way to really make sure you've got it right. But I think,
and also measure its broader empirical impact.
Right.
That's the key. Is that
right.
It's going to have impacts beyond just the people
Right.
that are directly affected. It's going to affect marketplace outcomes.
If it's an equilibrium model, that'll be in the And so more quantities and looking at quantities, I think, would be important. So Kevin's right. That's my summary response.
So Ryan?
All right. Well, thank you, Morris, and thank you, Ed. Delighted to be here. I was tempted when you asked me to be on the panel to talk a little bit about my work using the fantastic new CPS data that we heard about at lunch. But I think we've already heard a bit about that. We're going to hear more about the research later on. And I think in this panel, we're also going to talk about gaps in the research, I think, later in the panel. So what I wanted to do now is talk more about how the policy discussion has evolved recently and where I think it should go given the state of the literature on this. So just quickly, first, I wanted to mention a subset of recent work that I think is really useful, recent policy work. In no particular order, I think that the FTC and the NCSL have assembled quite a bit of work that's useful both for the broader public and for state policymakers. The National Employment Law Project, the Institute for Justice are two examples of groups I see as providing some really useful information on particular aspects of licensing-related problems. I think Morris Kleiner's policy proposal for the Hamilton Project was really influential a few years back. We followed that up with some work using the CPS data. Kathleen Adams and Sarah Markowitz have written a great proposal very recently on scope of practice, as Sarah mentioned. And then finally, I think the Obama administration report from 2015 was particularly useful for kind of consolidating what we knew at that time and laying out a conceptual framework for thinking about what we should do and what kind of best practices states should adopt. So I think that this work has done a lot of useful things. One of those things that I want to talk about is that they've pushed back against a tendency in the broader licensing discussion that I think is not ideal, and that's the tendency to focus too much on occupations where the licensing is just patently unjustifiable, right? So we talked about floristry. We've talked about, there are plenty of other examples of this. And I think that that kind of criticism is appealing rhetorically. It's hard to find people who, it's easy to get a consensus around it. But the problem is that it can end up having a really limited scope of application because it's not hard, and this was discussed in an earlier session, it's not hard to come up with a hypothetical conceivable public safety risk associated with practice in some occupation. It may not be plausible, but it's easy to come up with it. And if your implicit standard for questioning a licensing rule is that it only merits scrutiny if it can't have any hypothetical public safety implication, then I think we've really restricted the scope of what we're going to talk about. So what I think we're moving toward is a better set of questions, and it can be, I think, distilled as, what is the optimal type of occupational regulation in a given instance, and what is the optimal content of that regulation? So I think the optimal regulation is going to be closely tailored to any verified health and safety risks that you have for that occupation. And so I think what that will mean is that in a variety of occupations where most people would agree there should be licensing, you're going to potentially radically reconfigure the licensing because you're going to tailor the curriculum, the fees, the various stipulations in the licensing rules to the public health and safety harms, and you're going to apply rigorous cost-benefit analysis to the existing rules. So I think that approach can actually result in a kind of more wide-ranging and economically meaningful set of licensure reforms. And then another welcome development, I think, in the licensing discussion of the last few years is this increased emphasis on effects for particular groups. So I'm thinking of people with criminal records, military spouses, and veterans, and immigrants, among other groups. And I think the different aspects of licensing rules present particular problems for each of those groups in different ways. And I think there are some really some low-hanging fruit here in terms of opportunities to bring the licensing rules into a better alignment with the public purpose, and then also to help those groups. And then there are two broad things I think we need to emphasize a bit more in the licensing discussion. One is that my sense, at least, is that it's really important to have the kind of technical assistance for state legislatures, in particular, that NCSL is providing under its current initiative, and that others have provided in a sort of ad hoc way. But my sense is that not all states have the capacity to apply rigorous cost-benefit analysis to their rules, and that is part of the explanation for the dispersion in the content of those rules. And that I think you can take a fairly naive view of this, and some portion of it is right, that states could do better if there was more attention paid to kind of providing the capacity to do this sort of analysis. And then I'll conclude by saying that I think we need still more emphasis on something that's been discussed by a number of people here, but I want to just underline it. We need to think about the fact that licensing rules, when they're initially implemented, embody assumptions about the organization of work tasks that prevail at that time. And as we've just heard, these licensing rules are extremely sticky. And I worry about licensing rules, the stickiness of them, preventing new ways of organizing tasks, in the wake of technological progress, new ways of thinking about work are just going to be prevented by these rules in ways that we may not see. I think scope of practice is an instance of this, that as the healthcare sector changes, there are opportunities to kind of reorganize work across physicians and non-physicians. But I think it's a broader point than that, that I think we should be thinking about as we address licensing reform.
Well, thank you, Ryan. I just have two questions before I open things up to the rest of the panel. First, Ryan, you had mentioned the White House report, and I just wanted to publicly credit Ryan's contribution. He was uncredited as an author of that report. Going forward, what can the federal government, is there a role for the federal government in moving reform forward? And are there promising steps that the Trump administration and the current Congress are pursuing that will ultimately bear fruit with respect to occupational licensing reform.
I'm sorry for not being responsive to your question, but this is bugging me. The one thing I wanted to say about Ryan's framework is the reason that I said what I said about insurance is the following. If you own a business in Illinois, it doesn't matter what the business is, you have to have liability insurance. And there's a huge, thick book where the regulators have already gone through and said, if you're in this business, these are the types of mistakes you could make, and so these are the types of risks that have to be in your policy. And if you're the insurance broker and you don't, give the person the right policy, you can be sued on what's called an E&O claim, errors and omissions. You didn't give them the right. So there's a huge apparatus in every state already that says, if you do this, this is what could go wrong, and you have to have insurance to cover these risks. Then there's a whole bunch of property and casualty insurance companies with underwriters and big data people. And when the brokers go, they come back with 5 different quotes to cover those risks that have to be covered. And you don't need a set of people in, some state office doing cost-benefit analysis. You can subcontract that to the private sector where they do it all the time. And you can let the government do what it already does, which is to say, this is what has to be in your policy. If you're a pharmacist, if you're a nurse practitioner, if you're a surgeon.
Or a pharmacy, because let's say Walgreens has a mandatory insurance to cover, and all the customers, you're saying that the pharmacists that work at Walgreens should also have to have insurance?
I was saying a pharmacist that ran their own private pharmacy.
So it's the pharmacy that has to have the insurance, and then you're going to rely on the pharmacies then, being in their interest to hire people who. Right.
I was, because this is I was doing this kind of everybody's a sole proprietor, but that's fine too. But I'm just saying, what I think government has a lot of expertise and already has systems built for is writing regulations about what has to be covered in a liability insurance thing. And we can subcontract all the cost-benefit analysis to the private sector, and they can come up with prices based on your past record, on your schooling record, what your certification exam scores were, whatever their big data model tells them. This is what it costs you. And that gives people an incentive to behave in ways that they don't have to pay big premiums.
But let me give you another example. I hire somebody to work on my house. I can hire somebody who's licensed, bonded, and insured, or I can hire the local handyman to work on my house. Now, we don't mandate that those people have, maybe there is a law, but the guys are violating, I don't know which way that goes legally, but let's assume that guys are operating within the law, but they can't advertise they're licensed, bonded, and insured. They're just the handyman.
We all
allow that?
We all have stupid relatives, and like I have an uncle.
So when do we cross the line?
I have an uncle who might do that, and I'm willing to let him do that, and willing to let his house burn down. I'm not willing to let him have surgery by some guy that never went to med school. And we all have our different line. Where we're going to intervene and say, but in my way, that surgeon who never went to med school can't get insurance from anybody, and so he doesn't practice.
But he wouldn't have to be a.
But we're in the same.
You wouldn't have to be a surgeon. You're saying he wouldn't have to be a surgeon, but if you get an insurance company to insure him as a surgeon, he's a surgeon.
Right.
I'd like to give Ryan a chance.
I'm sorry.
So I was just going to say first that I've essentially dodged your question and the sort of call to arms here for a first principles sort of theoretical discussion of this. And I guess what I addressed myself to was more of a the question of, within working
Something that
from
can be passed.
working from the current set of policies, sort of how I think things have been changing and where I would like it to go in an incremental way. And that actually segues into my answer to Ed's question, I think, which is that I take the current state-based system of licensure for granted. And so I'm starting from that assumption that that's what we have. I think the federal government has a certain very limited set of things that it can do to help. I think that the Obama administration's report was useful for kind of setting forth some best practices that I think got people kind of focused on some incremental ways to reform licensure. There were efforts around joining forces, and then the subsequent bills that were introduced and enacted in many, if not all states at this point, that aimed at expediting licensure for military veterans and their spouses. And I think that there's a continued role for the federal government in doing the kinds of things it's doing through NCSL and NGA and CSG, where it's sort of playing a convening role. It's providing funds to continue to do analysis and just bring states together to kind of see what kinds of things they can achieve.
I got a question though. Is the experience you think that the federal government, who in certain areas does the licensing for financial advisors and all kinds of other people, they do a particularly good job at this? I mean, some of you look at those tests and what what it takes to pass those tests. Not clear. It looks like it does such a great job to me. And at least at the state level, you got some competition. You have to compete against other states. I mean, federal. Is there evidence that feds are really good at setting up the licensing requirements which is the poster child for, boy, here's a great case where they've really done a great job. Maybe in the medical area there's some I don't know about. I know finance area I know a little better. So I guess what I'm saying, where's the example where they've done, is it better to have it done federally versus statewide? It's not like federal politics is immune to interest groups and exclusion and all those things. Those same things that plague state governments would seem to plague federal government.
You're going to talk about foreign policy next?
Yeah, exactly.
So the federal government does license, a few occupations, but I wouldn't try to argue that it is systematically, I don't know of evidence that it does a systematically better job. I just think that other parts of the federal government that have tried to kind of lay out a way to think about this and a type of cost-benefit analysis to apply, I think it's useful for states to hear that.
So I would just like to say that the panel has accomplished what I hope we would accomplish, in that there's a big parallel here with education research. It's very common to go to ed research conferences, and there are certain people, and they're good people, and they do important work, and some of them are really good friends of mine. They restrict their attention in terms of their research agenda on doing research on policy to, buzzwords like politically feasible reforms or, incremental changes that pass cost-benefit analysis and reforms within the existing system that move the bar forward. And there's nothing wrong with that, and that's valuable, and that's probably in the end going to do the world more good. But I do believe, and what I was trying to get at in my slides, is researchers or somebody in the research community in this area should also be starting from first principles and saying, what really do we know from the large literature on mechanisms and contracts and law and economics, et cetera, and other areas that would inform what are the key factors that we need to think about when thinking about these different paradigms. And I think it's not saying anybody stop what they're doing, but it's encouraging people to add to the research agenda. I think there needs to be a little more first principles thinking about agency theory and contracts and design to kind of fill out the research community here.
I think go back, you mentioned earlier, like, how dangerous is it? But I think also the nature of that danger. How easy is it for people to get information about experience? Is it an experience good that, you know, I go there once and I find it's not safe and everybody knows it and that's a very different case than a case where if they did something wrong, it's going to show up 20 years later as a problem that I will never know about. And the need for some kind of, you know, information improvement, hopefully, to do it, but that doesn't enough because it's so infrequently purchased and transaction costs are so high that people won't avail themselves of the information. Then you may have to go to actual licensing, but I think you got to ask that first question first. Is there a need? Isn't there a market alternative? And I think the mechanism design in those literatures have kind of already abandoned the market alternative.
Well, I think if you do it well and you start by laying out your explicit assumptions about who knows what when, then you raise these questions you're raising. And you also identify the things where the market is the solution. And so I think the value of being formal and solving these, you know, different versions of these models is you make explicit the link between these types of informational assumptions and policy. And you make explicit, what are the things I need to say, I'm assuming, to say this would be a desirable policy? And I see that as maybe missing from the discussion here a little bit.
So yeah, why don't we take 3 questions from the audience? Dan, Brad, and Morris.
So for Dereck, in terms of approach, I think there's a lot that's salutary and that's been built into some policy perspectives for decades. First is, look, is there some market failure, durable market failure that the regulation, whether it's occupational or service-oriented, is supposed to respond to? Then is there any reason to think it does? These are all good questions, I think, and interest in seeing the market be able to do more. An interest in theory. We had an empirical roundtable last year. We invited people who were not labor economists or IO economists, but finance guys, one from Penn and one from Stanford, Berkeley, and Winsbergen, to present a theory paper, which we thought was really interesting and really useful. We'd like to see more formal theory development, testing of models. I think, so a couple things sort of gave me pause as sort of if there were sort of more than directional things, musings. First as well, we all, you know, none of us want a surgeon who's not licensed. Well, I sure as hell don't, but where does that come from is, I think, a perfectly good question. When do we say things like that and why and what's the value of this or that? Another thing that gave me a little pause, and I don't want to voice this upon you because maybe you didn't quite say this, is like, oh, we know how to regulate insurers. And they've got to look for this, that, and the other thing, and the big data thing is a little complicated in that they've got these very powerful correlation machines, and a lot of times they don't really understand what they're doing. And one thing we looked at is a very interesting paper last year about ensuring risk of data security, and you have risk-based regulation. Look at big underwriters for big firms and their data security policies, and we thought these guys surely know what they're doing, right? Basically the only main driver of the policies plus was the market cap of the company being insured. They didn't know how to look at anything they were actually doing and figuring out downstream risks associated with this. So I mean, that seems really fruitful. I'd like to see where that goes, but I don't want to, while we're doing the incremental work, I don't want to do too much wishful thinking about what the substitute mechanisms are.
Yeah, I would just say, one thing I would respond to, I think I agree with a lot of what you're saying, but this is, and it's tied into the last panel actually, because the difference between, say, licensing and certification really is very important because you said earlier, like everybody wants a surgeon who's licensed. The question is to do what? That is, do I need a surgeon who's licensed to fill out the form that needs to go to the insurance company? Do I need a surgeon who's licensed to give me a shot? Do I, you know? And so once you do licensing, it seems scope of practice is automatically on the table because it's a license to do what? And most importantly, what can't you do without a license? That's really the notion of scope of license. It's the things you can't do unless you have a license. The nice thing about certification is it's as broad as people want to make it. I give you the certification, hey, you're a qualified surgeon. And I don't tell you what you have to make out of that. And you say, look, if he's cutting into me, I'm going to require him to be a qualified surgeon. If he's filling out a form, I don't care whether he's a qualified surgeon. So that's one of the big advantages of certification over licensing is license by its very nature implies a scope of practice, which like you were saying, things are changing over time. What's the right scope for a surgeon today may be very different when technology changes and you no longer require that kind of a skill and expertise because the machine does all the work. And yet, if we have a licensing restriction, that same job is going to have to be performed by a licensed surgeon long after that. It's like pharmacists. I mean, they used to actually mix the medicine that you took in many cases. Now, for much of what they do, it's counting pills. And that machine does that anyway.
And it's like, you know, Morris said the original, he told me the story, the original barber thing came because there were infectious diseases that spread from, you know, that was 110 years ago. It's not relevant now, but you can't get the dang thing off the books, which is your point.
My point is you could say, well, you're certified, you know, disease-free barber. Well, that becomes worthless after a while. But the license, if it's a license requirement, and so the flexibility inherent in a certification world versus a licensing world is something we always have to keep in mind because licensing by nature has a limited scope.
Ryan, any follow-ups?
No.
Brad?
So I would like to, Brad Hirschbein from the Upjohn Institute. I would also like to put in a plug for the necessity of some benefit cost analysis, and which necessarily means that you need to have a social welfare function in mind, and that's going to be inherently subjective, but we should at least try and argue over preference parameters rather than argue over something without a framework at all. And the reason I think that that is necessary is because I have a lot of skepticism that the private market will work because there's going to be regulatory capture there too. You alluded to that a little bit, Dereck, and the case that comes to mind right now, which should be very salient today, is flood insurance. We've had several major hurricanes, Katrina, Harvey, now Florence. Lots of people are going to suffer from flooding. If the private sector priced that into the insurance, which mortgage companies would require, a lot of that development never would have happened. But because there's a reinsurance market subsidized by the federal government, it happens anyway because there was regulatory capture. And as a result, far more people are going to suffer and quite possibly die than a lot of the occupational licensing cases we're discussing now. So as long as the regulators, the people deciding who's going to let the private market dictate that, they're subject to being regulatory captured because there's money involved, I just don't think it's going to work.
You may be right.
I would definitely second that. I mean, the thing you always have to remember about private markets is they're really good at doing whatever they're incentivized to do. If you incentivize them to do good things, they're going to do a great job of doing that. If you incentivize them to do bad and dumb things, they'll be really good at doing bad and dumb things. And that's part of what happens. And, you know, people always think like, well, you know, markets are best, always gives you the best outcome. No, it does what it's incentivized to do. And, you know, you hopefully can set up a system where those incentives are robust enough that other market forces constrain what they can do.
Do you think it's worth just adding to this that there may be licensing rules that are, you know, appropriately, when they're appropriately tailored to the public health and safety risks, that are not particularly burdensome in the sense that they would not be binding in many states of the world. And it may be that for reasons of the kind Brad just gave, that this would be part of a second best, but you know, a system that has redundancies in it to kind of prevent some of the worst outcomes.
Morris and Albert, did you have your hand up?
I thought, first of all, thank you again for coming here and giving some very provocative views of licensing. Now, licensing has grown a lot, and I wanted to start out with some potentially devil's advocate first principles. And one is Milton Friedman in Capitalism and Freedom said, well, yeah, there's a huge number of people who are licensed, maybe up between 20 and 30%. He was surprised that not everybody's licensed. Richard Freeman, in a book not too long ago, said, well, licensing would be good, that you set up this mechanism design and that this would increase quality, it would set up very clear career paths, and this might be a great thing to do rather than zero licensing, which I think you're suggesting, having everybody be licensed. Just wanted to get your comment on that.
Well, I don't know what Friedman's argument was. Dick's a wonderful guy. He said a lot of things over the years I disagree with. What I was trying to say was that licensing and then the optimal licensing system is one approach. But we shouldn't restrict ourselves to thinking that fine-tuning that model is the only game in town. We should ask ourselves, how far could you get by requiring insurance and relying on a tort system? Or as Kevin said, how far could you get by having the government and private entities compete in certification systems? And I said that because I believe that the licensing system per se is just a very effective kind of rent-seeking mechanism because it's an explicit barrier to entry. And so my priors were that you might be able to do better. And then, of course, Brad said, well, look at the flood insurance program and look at the capture there. And we live in a world of second best. There's going to be information rents in any of these systems. I'm just trying to encourage people to think more broadly about all the options and to try to pin down, when I say I want this type of system rather than that type of system, what am I really saying about my assumptions about what consumers can and can't learn and what private actors like insurance companies can and can't see in different types of occupations. To just be very clear, and how politics works. And I mean, a lot of this is coming from education, where I just see too many people, they're focused on, well, we're stuck with the traditional public school model, and will this pass cost-benefit analysis if we tell all schools they have to do this? And I think that's kind of tying your hands behind your back in terms of finding creative ways to do better.
Albert and Maria.
So kind of similar to Dr. Kleiner, I'm going to suggest something, and I'd like to get a response from the panel, maybe starting with Brian. So we heard y'all mention that licensing may be set up due to regulatory capture, but I think that the research that was presented by Drs. Blair and Grosjean earlier today may kind of challenge that assumption, where we were seeing some of the largest gains for licensing in terms of license holders are among the less educated and traditionally disadvantaged groups of the population. I think it's probably unlikely that those are the folks who are directly lobbying, or that those are the folks who are leading these trade associations that do push for these licenses. So that's kind of my first suggestion that I'd like to get your response to, how that might fit into your framework, and if that kind of disrupts your thinking that this is a regulatory capture issue. And then my second is for legislators or any policymakers who would argue that this is not this policy tool is not being used to address information asymmetry, but rather is one of workforce development, and the purpose of licensing is either primarily or at least partially for the benefit of the licensed. How would your framework fit into that, and kind of what would your response to someone who's looking at it that way be?
I would just start maybe real briefly, if it's okay, just to say that I think I'm skeptical that we have a great understanding of exactly why licensing has evolved the way it has in every instance. I think the simplest version of the public choice story is it's not clear to me that that's always the right one. There are a lot of different things going on, including these kinds of turf battles, other forms of rent seeking, like training providers that have an interest in licensing rules being implemented and strengthened. And the public interest argument, I think, should be taken seriously, that I think that has motivated licensure in at least some instances.
I just don't buy the premise. I mean, Diane's not here, but Diane's done really cool work showing that the food stamp program actually helped people. That doesn't mean that the agriculture lobby hasn't used the food stamp program as a tool for their rent seeking. And we can find reforms in large public school systems in this country that benefited poor kids, but because we paid twice what we had to pay for the new program, there were also large benefits that went to the teachers union that lobbied for the program. So the idea that there aren't well-organized groups out there that can seek rents for themselves by charging consumers and taxpayers more than the market cost of producing what they're producing, and then give some of it to poor people to strengthen their coalition. The idea that that's not a thing, I mean, you're the political expert, but I see that all the time. And so I don't buy the premise of the question.
I would add two things. One, and maybe it's not adding, just reiterating, but one is you can't measure it by the gain to the people who get in. I mean, the primary effect on a lot of groups is how many people get in. Maybe the guys who make it over the hump get a great increase, but a whole lot of more guys would want to come over that hump if it wasn't for the restrictions. So, you know, if you think about unions that used to keep African Americans or other out.
In Chicago.
Yeah, that the few African Americans that got in, they did really well. But the truth was, the biggest effect was the number of people who got into those professions was restricted. And
for a long time.
And if you went out and measured the difference between the guys in and the guys out, you'd say, wow, this is a great program. The African Americans get more than anybody from getting in. But the fact that there's such a big gap is an artifact of, partly at least, the fact that they're keeping people out. So that's number one. The second one is, I think capture isn't always part of where these things come from, but it's got to be part of why they stick around. I mean, they're just because you develop all these interest groups, and whether they're the people in the profession, whether the people who train the people into the profession, whether the regulators who get to choose who's in. I mean, you create that. No matter what the original intent may have been pure as anything, like, oh my God, we got this huge problem, we need to put this licensing regime into place. Chances are 20, 30 years later, whether that's gone away or not, you've established a bunch of interest groups, and that rent seeking or rent holding on to, I don't know, it's not even seeking new rents, it's just trying to hold on to ones you got already, is got to be part of a lot of these regimes and why they stick around way after they're needed. So I wouldn't just focus on how they start, but what keeps them going, and also what maintains the scope of practice. To go back to the physician case, there's no question there are a lot of things you want a qualified physician for, but the physicians aren't going to give up the things where they're no longer have to be a physician to do it. They're still going to say, hey, we got that, we keep it. So. And that's a tough thing about licensing.
It's like union work rules at the university, right? If our light bulb goes out in our office, we can't change the light bulb. We have to call someone who, according to the union contract, has authorization to come change our light bulb. And these things are.
Carry the ladder. The guy, the
and-
ladder man
right.
has to bring the ladder, and then the guy who changes the light bulb has to
Right.
climb up the ladder.
And, John Cochran got in serious trouble 20 years ago for putting in his own air conditioner without a work order. These things, these licensing things, I think are very analogous to union work rules for members of public sector employee unions. There are ways to restrict the ability for somebody to substitute for somebody that has a card that says, we're the only ones that can do this.
Maria, any others? Yes. Sir, and Peter, and then I think we'll be done.
Thank you, Ed, and thanks to the panel. Going back to the sort of the agency theory approaches, and I think that's a really good sort of theoretical kind of framework to think about this, because this whole, a lot of the licensing justification, is this making a noise? This is me.
Are two of them on there?
So a lot came from the whole information asymmetries, moral hazard justifications for introducing licensing. And I would like to get the panel's views with regards to the role of technology in addressing some of these concerns. So a classic example, in London, we have our taxi drivers, the black cabs, and they undergo through very, very lengthy and costly training. They memorize all the streets in London and everything. And now you have Uber, and now you can look at your phone, and the phone can tell you not only how to get somewhere, but also the fastest way to get somewhere. And it's tracked by Uber, so any risk to the public is not there anymore, because they know that everyone knows where they are. So then, and other examples include plumbers. We've got these wonderful platforms in London where you can rate your plumber. And I was actually talking to one of these associations that collect this data, and they say for every one negative review they get, they struggle to get business for about 6 or 7 months. It takes one negative review to make up, it takes about 20 positive reviews to make up for one negative. So again, this is solving reputation issues, which justify the emergence of licensing in the sort of the in the industrialization era or urbanization era, where we moved into big cities and we didn't know who our doctor was or our electrician was. So what is the role of technology? And perhaps, I don't know, I suppose, going back to what you were saying, one solution would be the insurance, but I personally think, technology can go some way these days.
I would say in a world with Angie's List and whatever list, and my son works for Power Reviews a few blocks away from here. I'm with Kevin. There's no need for licensing of plumbers and carpenters and yada yada. If they want to have a thing that they can show you that says they passed the master plumber test that's given by the union or the state association of plumbers, more power to them. That's certification. But in the age that we have now, where there's so much information that's easily available, I can't see any reason for licensing plumbers. I mean, Kevin might not want to license surgeons. I don't know that I want to go there yet, but certainly for the plumbers and the electricians, we're on the same page. He's
Or the cab drivers, where you use that service frequently, and even the private cabs, the ones who work for Uber. I mean, obviously Uber had, if it was in their interest to say, we're going to make everybody who drives for Uber pass some test, I could go in business against Uber and say, my drivers have all gone through a test, and you'll get what Uber doesn't give you. And, it's...
I think I'd be more comfortable saying that technology has strengthened reputational markets to that extent if we had more evidence about the interaction between licensing and these new kinds of reputational markets. I think this is an area of active inquiry. I think Brad Larson and his co-authors have work, and others do as well. And I'd like to know more about, just empirically how that's working with the licensing system.
Davud.
My question is what we can learn from theory, because there is, in my view, two sets of strands of the research. One rent, which is focusing on rent seeking and the cost of it. The other one that assumes that there is quality uncertainty and the literature on quality uncertainty actually does state the assumptions and look at different reputation mechanisms. And a recent paper by Christian Hellwig and co-authors finds that entry regulation in combination with price regulation is an optimal policy under the given assumptions that they make, but they assume also that there are no differences in preferences of consumers. They also assume that the regulator knows the right price, something like that. So what can policy learn from theoretical paper and even empirical research? Because at the heart of all this discussion is what is the risk that I'm facing when I'm buying something? What is the uncertainty, the degree of uncertainty? Can you measure it somehow? How can you do that? And how can you reduce the uncertainty? Because it's also really boring if you have a setting where there is no externality or no problem to write a paper about it, because you already solved it. I agree that insurance markets might solve most of the problems, but you have a hard time to get published with that result.
Not anymore, thank goodness. I think I don't know what you would find until you did it. The mechanism that Gotti and I proposed, that we said, this is the optimal assessment-based accountability bonus system for teachers, because you can use a separate test that's not scaled so that people can't coach to it. There is no scale to corrupt. It's pure relative performance, so you can't inflate it so everybody gets a bonus. We let all these, so these are the axioms for what it would take. You'd have to avoid these things. And then we showed in a context where, all the teachers were teaching a bunch of different students, and you only had ordinal information, how each student did relative to his peers, you could still get first best effort on all activities from all teachers that influenced all students. And I don't think anybody would have guessed that was the answer. Even Kevin, as smart as he is, I think he was a little surprised the first time he saw it, that moving to a job where you were producing multiple outputs at the same time, and you could only rank each output, so you didn't have any ranking of total output across people who were doing this, you could still get first best effort. And I don't know what would come out of saying this is exactly what are the things I think consumers can learn, can't learn, the things they learn fast, the things they learn slow, the things that an insurance company can see, the things that providers can hide. I don't know what would come out of it, but I would like to see kind of a general expression of the problem, so you could say, well, if you believe this, you want the tort solution. If you believe this, you want the regulation solution. And among that, you want the certification, not the, I'm having a hard time, not having worked on this, solving it in my head. And knowing if we take the Hellwig paper and we start playing what's robust and what's not robust. But I think, I'm not saying everyone should do this. I'm saying someone in this room should have that as their research agenda, to kind of discipline all the interesting empirical work.
Yeah, I mean, I guess the other side I would say is, like take the taxi cabs and Ubers. I mean, one of the big questions there is just how much does the existence of the unlicensed alternative affect the efficiency of the licensed alternative? Because it's kind of like the private school, public school kind of thing. I think those are really important questions because, again, that's the trouble. If you sort of try to monopolize everything and banish competition, then you have a lot of efficiency consequences. So allowing
the best benefit of Uber is I haven't had any cab rides at 80 miles an hour down Michigan Avenue during rush hour. I mean, the crazy out of some movie, I'm going to die any minute cab rides Even when you use cabs, you don't have those rides anymore because, you know, they know you have an alternative.
Peter.
Yeah, thank you all so much for this really excellent panel. And I want to agree with you, Dereck, which is that we should really be thinking a lot more about this from the perspective of a mechanism design. And in our paper, like, we do have some calculations that looks at what's the optimal cost of licensing, right? So you can think about having licensing versus not as being completely binary, but the cost itself is on a sliding scale. And then Morris has some recent work with Evan Saltis that puts down a very, I think, probably the most comprehensive general equilibrium model of occupational licensing that we have. So that's a really a great starting point. And then he also has some work with Jason Hicks, who's in the room, looking at Uber drivers, right, to see whether, in fact, licensed cab drivers do provide benefits. And I think the result is that you don't see any quality benefits for licensed cab drivers. I want to touch back to Albert's point, because I think his question is really important, right, in light of the heterogeneity and the impacts of licensing by race and gender.
No, I just had a question on that. Are you saying that the license system isn't affected by the president of Uber, or the guys who are licensed don't do any better within the Uber system than non-licensed?
That's right. The licensed guys in the Uber system don't do any better than the unlicensed.
I would believe that. I would predict that, but I would figure that the licensed system has to respond.
That's missing.
Yeah.
Companies.
Now, the one thing that I think we have to think really deeply about is, do we actually know what the counterfactual is? And it's one thing to write down a model that says this is the mechanism design problem, what we should do is have insurance. But as was pointed out, like, when you look at flood insurance, it's a huge problem. We don't, even if you look at health insurance, like, we haven't been able to figure that out. And it's pretty obvious that people that need health insurance. I also wonder what might happen to premiums if we put the burden on insurance companies. Ultimately, one potential equilibrium could be that those costs are still passed on to consumers. And if you have one litigious consumer who happened to have some dust in their flowers, that could be a $100 million lawsuit. That has this huge externality on everybody else that's in that market too. And so when it comes from the standpoint of thinking, first you have to think about what the counterfactual is. And then when it comes to policy, some of these counterfactuals could produce some pretty expensive results. So, like, how do we create laboratories to test those? Those are, like, really serious things. And I'll end with one kind of practical example. So Amanda Egan and Jennifer Doliak and also Ben Hansen, they have some really interesting papers on the ban-the-box regulations, which are, in these states, employers are not allowed to have that checkbox where you can indicate if you have a felony or not. And what they find is that when states remove that information from the job applications, that you actually see firms hiring less minority workers, right? And that is a complete unintended consequence, right? And at first blush, you might say that that's really confusing. But when you think more deeply about it, what is happening is they're removing vital information for the labor market. And the labor market is sorting people on that information, right? And so we have to really think about that. And even in the licensing context, right, when we think about the work that Bobby and I have, one of the concerns that we have is that if you remove all of this information about the felony status of workers, could you see a similar thing too? Where not only do you lose these gains on the intensive margin in terms of, like, the narrowing of the racial and gender wage gaps, which we document in our paper, but could it be the case that now all of a sudden firms start to see minorities and women as riskier bets, and they actually start to hire less women and minorities as a result of not having this licensing information too? Now, we might not be able to see something like this in just the observational data, but if we were to implement this policy experiment, we're moving to a huge new equilibrium. And something I'd like the panel to comment on is, how should we think about reform insofar as we're moving from one equilibrium to another? And is that something that ought to happen in an incremental way? Or if we just in one fell swoop did a massive change, do we expect that there could be huge general equilibrium effects, some of which might be unintended?
I think you want to, I was just going to get rid of the ban the box legislation. I mean, if you got rid of the ban the box legislation, you wouldn't need the licensing thing to fix the problem caused by the ban the box. So adding a license thing that turns into a capture thing later to solve a bad public policy is not the most direct solution to the problem. Get rid of the ban the box.
No, but the
Now
two,
get-
hold on, Dereck, but that's not a fair comment because the two aren't related. I just use that as an example of a situation in which the intended effect of the policy was very different from what actually happened. So it's not, I wasn't trying to say that these two things are connected per se. So I just want to be very clear about
But,
that.
I mean,
Just
I
go over your
think
graphs.
one way to think about it, and this is why I was so pressing before on looking at the quantity effects, because a lot of times what show up as quantity effects in a partial equilibrium situation turn out to be price effects in a general equilibrium situation, because what would be in a partial equilibrium is going to show up as a bunch of people go here versus there. Well, in the aggregate, that can't happen, and prices have to adjust to accommodate that. So at least, and this is where you need a model, but if you had a model, you can actually say, well, geez, what I'm seeing in a partial equilibrium setting, I can still measure what would happen in a general I need some other parameters, but at least I got the ingredient that would be different, which is that quantity change can't happen. And, you know, whether it's a state change in a tax rule and I see a bunch of workers moving across state lines, and you'd say, well, in equilibrium, they're avoiding this impact, but if we did it on a national level, you'd have to go back to what the elasticity demand is, but it wouldn't be the same as it is at the state level. So again, that's why I think you want to study not just, even if you're only interested in what's the wage or employment impacts, you got to study both parts because the aggregate one's going to combine those in a different way. It's going to get a different mix between those two.
And it was your graphs. All your results were driven by the states that had to ban the box. So you told us that the licensing was valuable because of the ban the box. And I'm saying that the lesson I learned from your paper was not licensing good. The lesson I learned from your paper was ban the box bad.
I'll take that to Dereck Neal learned something from my paper. I'll take that. I'll take that with
Licensing can
pleasure.
be providing information, I think.
Yeah.
And the ban the box was just a way of evaluating the information as opposed to selection hypothesis.
Yes.
And it could be, in a world of only white men, you'd still have licensing providing information. I guess what I would go, and this was my comment before, yeah, but so does certification has information without the same restriction. And would certification allow you to get the information without the adverse consequences? And again, as I mentioned before, to me, one of the big differences is the difference in flexibility.
Yeah.
And, you know, maybe I got the wrong certification, but people still can make what they can make out of it. If I have the wrong licensing restrictions, I know I'm screwing up the equilibrium. So.
I think there's one practical parameter that was relevant to this back and forth, and this was something that we tried to do and fell flat on, which is rather than even banning the box, you can indemnify employers against malpractice lawsuits for hiring a former felon as long as that felon did everything they were supposed to have done and were rehabilitated. And so that, there's a reason why the employer has the box, and that's because they can get sued for employing somebody. We tried that, and it immediately crashed and burned given the trial attorney bar.
Yeah, I mean, and that gets back to a point that was made before, which is what's the real alternative? And if there is the political pressure to do something about this problem, the alternative is not to do nothing. It's either are you going to have a labor market restriction, or maybe it's an output market regulation. And those are going to suffer from a lot of the same rent-seeking and permanence problems that you have there.
And I'm not going to take any crap from anybody about being a pie-in-the-sky theorist, given that he just admitted they tried to buck the trial lawyers in Illinois.
Well, actually, part of my original licensing proposal was to get rid of the requirement that you go to law school to take the bar exam. That one also flamed out pretty quickly.
There are states that have that, right?
Just California and Nebraska.
Yeah, there's a couple states.
But there are a
I
number
think
of
it's two.
countries, the Netherlands also, and Finland doesn't require
Well,
law school.
it's the mother lode in terms of
They require no
monopoly.
licensing of lawyers, so it's even
further.
I do think it would probably set the record for the most entrenched monopoly, because these other ones are monopolies that are controlled through the legislature. I mean, they're state-sanctioned monopolies, but at least there's a political process. But the lawyers, it's a protected monopoly, and they also control their, it's controlled by the courts, not by the legislature, the licensing. So there's not even a mechanism to really get rid of it.
Can
And
I
all
just,
the legislators are lawyers.
I'm Jenna Johnson. I just kind of think that you guys kind of distracted from Peter's original question, which I really want you to try to answer here, which, because I agree that, we need, it's not a bad idea to consider, different things besides occupational licensing. Consider insurance markets, consider, look at the first best principles, look at the mechanism design, like how can we do this in the best way? But we need to acknowledge that as much as it's fun to think about models and fun to think about, oh, well, if you move this, maybe this will happen and let's build this in and do all this math. Well, we need to realize that as well as we can design these models, there's going to be things like the work by Amanda and others about the ban the box thing that you're not going to anticipate. And you're not going to be able to build that into your model. So I think what Peter was mentioning, he was trying to get at this, how do we test these alternatives, right? Like in the, because only through those tests can we actually try to, we can't build policy based on, a fancy general equilibrium model. That's just not, there has to be some sort of empirical evidence to back this up, that this is actually, because otherwise we're going to have another,
You realize where you are?
What?
You
I
realize
know
where you
exactly where I
are?
am. My PhD is from University of Chicago. I know
You're
exactly.
in the Fed.
I know I'm in the Fed. Yeah.
That's all they're doing here today is trying to think about policy with a big fancy general equilibrium model.
Okay, yeah, well, fine. Well, great. But, so I just want you to, so what I'm saying is that I agree that with your point completely that, just limiting to ourselves to what is current policy and thinking about just tweaks there, maybe we should consider bigger things. But, the reason we're all here and we're all interested in occupational licensing is that we're interested in making the world better starting from where it is right now.
But I think, this gets back to, like, where do you draw your evidence from? And I think that's where theory is the most helpful, in that it allows you to take a situation that's different than the one you're looking at and bring the evidence over from there. That's the role that theory plays. Rarely do we get the answer by starting with the theory and working out all the Newtonian mechanics, and here's the answer. It just doesn't work that way. The way it works is, I got an empirical experiment, and I understand what it's telling me about some very narrow question, and then how do I take that to a broader question? That's the goal for theory, and maybe I've measured the wrong things, because even though I'm interested in prices, I measured prices, and that was stupid. I should have measured quantities. And that's where theory really helps. And
I'm not disputing that at all.
I think that's what I would say is the goal of theory, not to start and hope I'm going to get the answer from the beginning.
I'm not going to disagree with you on that. I'm just saying that if we want to, if we think that, if these models or whatever it is, and we think that we can try these insurance markets, how are we practically going to do that?
Well, let's look at situations maybe very different than the one you're interested, where somebody has mandated insurance compared to a place where somebody hasn't. You got to go to another context. And you're talking about, let's mandate insurance for taxi drivers, which is probably a stupid idea, but let's just do that. But let's do that and then say, well, okay, but where we mandated insurance? We mandated insurance for these professions or these firms. How well has it worked? Where has it failed? When do we get capture? When we don't get capture? And, flood insurance is a weird one, because we've kind of a situation where we've created, quote, the market for flood insurance, and that having the market without an external benchmark is the ripe case for capture, because, what's the equilibrium is whatever is we got no comparison. So
I do think we're going to learn from the different ways that states start experimenting with different types of reform proposals. I think in some ways, we talk about the importance of harmonization, but in some ways we need more diversity of this kind of experimentation. And I think of a kind of related labor market institution, non-compete contract, where you've got a state like California that has just made them unenforceable. And then you have states like Florida that have very strictly enforced them. And, you can learn a lot from those sorts of differences. And I think we'll see as states are, the pace at which they're experimenting with different approaches is accelerating.
Yeah, and if you're interested in technology, we have places where technology has come in earlier than in other places, and how is that affect? There's lots of, and all I'm saying is that the real goal of theory is to take a very distant seemingly distant thing and say, well, it's really the same question. It just looks so different because it's in a different context.
And my answer is I can't answer your question because I haven't done it. I mean, these experiments that have been run in China and Uganda and are all testing a mechanism that before I sat down and tried to be very formal about it, I wouldn't have guessed that this was something you should try. And so I think the process of trying to be more formal about what are the costs and benefits, what are the pros and cons informationally of different approaches might lead to empirical strategies for evaluating those concerns. But I'm evading the question because I don't know the answer. But you caught me evading.
Thank you for that. Thank you.
We have about 5 minutes. Short question. Davud, you got it.
Short question. So when I talk to policymakers and tell them, let's do some experiments, we don't know the answer to the outcome. They say, let's not do it because it might have huge costs. So we won't let you do your experiment and observe a counterfactual or a different policy, run one state with certification, the other with licensing. That's not going to happen because that's just not fair to do to the customers. So there's a problem to implement that on the policy side, in my view. Yeah, I would like to hear you comment on that, please.
I agree that it would be hard to run an experiment like this. I think it's hard to run experiments in much less challenging situations than this. So,
the question is, can you get away with the variation that occurs for other reasons? Is that going to help you, even not as a pure experiment, help you answer the question? I guess that's really.
Yes, sir.
I know of at least one Nurse Practice Act that does enable limited time experimentation to take place, so that you can introduce something, you can evaluate it, and you then have to take a decision whether you're going to shut it down or not. And that's the Texas Nurse Practice Act. And I think looking for some of those opportunities might be a way of testing out some of these ideas.
Morse?
Question that Richard Freeman would ask: What's the most important question you'd like to see answered in occupational licensing research?
Let's let Ryan answer this one first.
I'd honestly like to know a lot more about the benefits, the rents that accrue to training providers. I think there's some work on this, but I'd like to see a lot more of it. And if I can, well, I'm just going to add another one because I think it's a similar level of importance. Understanding the entrepreneurship impacts seems really important. And I think that as we accumulate more administrative data and firm level data to complement the worker surveys, I think we can start to make some progress.
I guess I would, this is mostly outside my area, but I think trying to establish what limited circumstances are actually some consumer benefits from these kinds of programs. I think it's going to be tough to find them in most cases, to be honest with you. I just think, and then again, you get into what's the alternative. If you say relative to nothing, maybe there is benefits, but I would think it's hard to find that there's not good alternatives in most cases to the regulations that we see on licensing. And I guess I would agree with that. I do think looking for interest groups and durable. I think the key thing about the providers, they're durable. They have an incentive to invest time and money, and there's a small number of them. So when I look for interest groups, I generally don't look for 1 million people who might benefit or lose. I look for much more concentrated groups, and that's why I think focusing on providers of training, for example, would be a good one.
So Kevin gave half of my answer, I think, because we had a lot of lunches together with the same person over the years. But Becker used to rail about the median voter model being wrong, and he was very much in favor of these interest group models of politics. I would like to see more work, both theoretical and empirical, on the question of why we can't get rid of the barber licensing, why we can't get rid of the master's salary bump for teachers, why once these things are there, and they're even, and this is Kevin's thing about licensing being much more dangerous than certification, why you can't get rid of licensing provisions that have become obsolete and are clearly against the public interest, and everybody knows it, but we can't get rid of them. Is the interest group model of politics the right model? And if it is, what does that say about legal, constitutional, other reforms that would try to thwart that? But that would be the thing that I would be most desirous to understand.
Well, please join me in thanking our panelists.